from Louisiana's home team. This is Fox 8 News at 6 a.m.
Well, as seniors age, some often ignore aches and pains that could indicate a serious problem. And joining us now with more is Dr. Diana McDermott with People's Health. Good morning.
Good morning.
Thanks for coming in. Well, let's start with memory-related issues because sometimes people may just write it off as nothing. Why should we pay attention to that as we age?
Well, because sometimes memory is a sign of some underlying problem. It might be a complication of diabetes or hypertension. Sometimes it also might just be the beginning of some dementia. Some people know as Alzheimer's dementia. The important thing is that the distinction between dementia and just and memory loss from other reasons is that that for Alzheimer's type dementia, you usually have intact memories of like your distant past, but then you're becoming forgetful of things that are sort of more common, like where you placed your keys or which medications you've taken this morning or what date it is even. Lots of things can help make this better, such as exercising, getting a lot of sleep, and making sure that you're eating good types of food. And some medications, if started early enough, can actually help prevent the worsening of dementia.
So what's a symptom that is not that bad, and what's a symptom with memory loss? Like, give me some examples when you should think that's like serious, if you witness something or you're experiencing something.
Well, lots of people come in and tell me that they're having problems with memory loss, but I definitely worry more if they're coming in and telling me that they're also having some other neurological complications. Like, for instance, they're having weakness on one side of their body, or slurred speech, or some other tingling or numbness. Those are definitely things that would make me look for another reason other than just, calling it dementia.
Okay, what about eyesight? As we get older, some people just assume you're going to lose your sight, but what are some symptoms and things that's an indication there's something serious?
So eyesight, again, is another example of, might be pointing toward an underlying disease. So hypertension and diabetes, again, can cause problems with eyesight. And in fact, I had a man a few months ago who came in, said he couldn't pass his driver's exam because of vision problems. Turns out to have diabetes. It was his first doctor's visit in over 15 years.
So basically, the things that you may think is nothing could be symptomatic of something really serious.
Definitely.
What are some of the other things that you see in seniors that they should pay attention to?
Well, this month we're actually focusing on urinary incontinence, and this is an important thing and an issue that's dear to my heart, because this is a issue that is addressed directly to the public in the form of medication sales and direct consumer advertising. But the problem with incontinence is this might not be a problem that is best dealt with medications. It's actually usually a symptom, again, of underlying diseases. So with women who have had lots of babies and have had lots of vaginal deliveries, their pelvic muscles can become weak so that they can start to develop incontinence. And they come in wanting medications, and yet those medications and the side effects from them actually prevent them from being able to live as comfortably, and then I really want to focus in that particular case, rather than on medications, on some behavioral issues or some behavioral changes. So things that work really well for incontinence are the exercises, such as Kegel exercises, which are the tightening of the muscles that you use to urinate, and just holding on to that and holding it for a few moments and then relaxing it. Exercising those muscles will actually help to prevent incontinence in the future.
How can people learn more about all of this?
So that they can go to People's Health Network, has a website with lots of information about these types of issues, and of course go and talk to their doctor.
Okay, thank you so much. Some good tips to know, because we're all aging. It's one form or another, or have someone in our life who is. Thank you so much, doctor, for coming in.